I noticed. Okay, there we go. I was waiting for the record. Thank you. Okay, Commissioner Ding, Commissioner Angelatz,
Present.
Commissioner Donnelly,
Here.
Commissioner Kung,
Here.
Commissioner Watson. I don't see Lisa, and then Commissioner Cow. I also don't see. So we have, I think we do have a quorum, but are missing a couple of commissioners. Why don't we go ahead and get started with public comment?
Good morning. We'll start with public comment for attendees here in person. The first one is Ernest Arnaldo.
We do have 2 general public comments. Those have been submitted online for everyone to read.
Okay.
I'm sorry. Are there any general public comments for anybody that's present other than being online, or is there anybody that is present via Zoom with public comments?
Chief, there are no people present or via Zoom.
Great, thank you.
I'm seeing 2 attendees raising their hands. Does that? Do they
Commissioner
need to have
Cow
submitted?
is waiting to be elevated. Sorry to interrupt.
Thanks, Jeremy. Can we elevate Commissioner Cow?
Sorry, we were having a little lag on the internet. It just showed me the raised hands now. The first one is Julie Ruelas. I'm going to allow her to speak.
Thank you. Please go ahead.
Before we begin, is that for general public comment or will that be for agenda item 3?
Yes, good morning. This is for agenda item number 3.
Okay, if you could just hold on, please. We're taking general public comment before we get to the agendized items.
Okay. It sounds like there are no other general public comments. Why don't we move on to the next agenda item? But in the meantime, would you mind promoting Commissioner Cow, please?
Sounds like we're having a little bit of a technical issue with the delay.
There are no more general comments. There is none via Zoom, none in person.
Okay. Thank you. Okay, then why don't we go ahead with the minutes of the Public Safety Commission meeting from September 13, 2021. That was in the agenda packet. Do we have any?
I'm sorry, Commissioner Al-Sarraf, can we hold on for just a moment until we have Commissioner Cow elevated?
Yes.
Mr. Chair, they are working on it. There's just a little bit of delay in the council chambers currently.
Okay. Well, why don't we take a moment just to until that happens. Okay. All right. Good morning, Stephanie.
Good morning. Thanks for that.
Sure. So why don't we go ahead with agenda item 2, the minutes from September 13th. Does anyone have any comments or changes to the minutes that were circulated? Okay, it doesn't appear to be. Do we have a motion?
Motion to approve as written.
Okay, Commissioner Angelatz brings the motion. Do you have a second?
Second that.
Okay, Commissioner Cow seconds. And let's do a roll call vote. Commissioner Cow,
Yes.
Commissioner Ding,
Yes.
Commissioner Donnelly,
Yes.
Commissioner Angelatz,
Aye.
Commissioner Kung,
Yes.
and I will vote yes. And the motion passes. Minutes are entered. Now let's move to agenda item 3. It seems like we're going to have a good number of public comments. We've seen a few already in writing. Why don't we go ahead and start with public comment for agenda item 3?
Okay, we're going to begin with the individuals in the chambers. So first, I would like to call up Ernest Arnold.
Wait a minute. I remember one is just 2. Ernest Arnold, 1230 Oak Hill Avenue, South Pasadena. I'm speaking in opposition to the prohibition of all tobacco products in the city of South Pasadena. Specifically, I'm supporting Ferox cigars, having to do with, as a product, cigars are not targeted to youth, and I can understand protecting our underage from being attracted to tobacco products. But Fayez has owned Ferox cigars and has been in South Pasadena for over 24 years. He has supported the community. He's been very generous with his time and money when asked to donate, whether it be the SPEF or the schools. But at the same time, he has never advertised in the high school football program because he doesn't want to advertise tobacco products to children. So it's been a company that draws from the area. There are people that go to Ferox Cigars from Pacific Palisades. They come in from Claremont. They come up from Orange County because they like the business. They like the community. And those people who come into Ferox Cigars from out of town, they spend money here. They go to the restaurants. And this is Ferox Cigars is a very good representative of who we are in South Pasadena. And if it's prohibited from smoking cigars, that would shut down his business. Probably about 90% of his business is in fact cigars. So I'd like you to take that into consideration in recommendation on the ordinance, because we shouldn't have an ordinance that drives out good businesses in the city of South Pasadena. Thank you.
The next person is Beta Babe? Oh, Rita Bibi. My apologies.
What's that? Okay. So since March of 2020 and a lot of 2021, our small businesses have gone through hell and back several times. And our city of South Pasadena has suffered because of this as well. And the reality is that the city has been suffering actually even before COVID hit. In 2018 and 2019, I listened to our city officials talk on several occasions about ideas of new ways of generating tax income for the city. And they even did surveys throughout the community about what they thought about the different ideas, including allowing dispensaries to open in the city for tax revenue. They talked about mismanagement of CalPERS and how our city employee pensions were in big trouble. And then they needed to figure out ways to generate more tax revenue sooner than later because of this. So you can imagine my surprise when I heard that you were discussing the ban on tobacco products in this city. I get that people have their opinions on tobacco products, and I get that people think that if we don't sell them in this city, that less people will smoke. And I can assure you that is not the case. It does not matter if you agree with smoking or not. People who smoke will just go elsewhere to buy their tobacco products. And their tax dollar will go to supporting other cities instead of ours. Not only will our city lose tax revenue from tobacco products not being sold in it, it will also lose tax revenue from other products. Think about it. Someone stops at the liquor store to buy alcohol, they usually buy tobacco products and snacks as well. If they stop for gas, they might buy cigarettes, snacks, lottery tickets at the same time. If they can't buy everything in one stop, they will just go somewhere else where they can buy everything in one stop. So the city won't just lose tax revenue of tobacco products and sales, it will lose tax revenue from other products, as well as the possibility of any tax revenue if the business can't survive because their customers are going somewhere else because of this. Some of these businesses in the city that carry tobacco products are only a couple blocks away from surrounding cities where a customer will go because they will be able to buy tobacco products in those cities, and it will destroy some of our South Pasadena businesses. I get that people hate tobacco products because they feel that they're unhealthy. I get that. And you know what else is unhealthy? Processed foods, MSG, dairy products, sugar, just to name a few. Are we going to ban fast food and grocery stores from selling those because arguably those products are far worse to people's health than tobacco products are? If you don't like a certain product, don't buy them. If you don't like certain musicians, don't go to their concerts or buy their music. It's the same about a movie. If you don't like it, don't go. People know about health consequences of their choices regardless of the product. And if they choose to do something anyway, it is their choice. Banning the sale of tobacco products will not only stop people from buying them, it will only stop them from buying them in the city of South Pasadena. And the only thing that this is going to hurt is the tax revenue of this city, and it's going to help other cities. And I don't think that that's something that this city can afford to lose. Thank you.
Is Faiz Quorum?
Good morning. My name is Faiz Karoum. I'm the owner of Fair Oaks Cigars and Spirit at 806 Fair Oaks Avenue in South Pasadena. I'm here to tell you a little bit about my business, what impact this ordinance will do. Been in business here for about 24 years. My sole business is to sell premium cigars with a little bit of liquor, a little bit of cigar accessories. At no time that I ever supported the sales of cigarettes or vapes, especially to minors. Anyway, this ordinance, well, before we go to that, I supported the city, supported the schools, supported a lot of organization in the city. Also, so this ordinance, what we'll do is will put me out of business. It will hurt my business, my family especially. You have a wife who's a cancer survivor, have a young daughter in college, a young boy in high school, and I will put me and my family on the street if this ordinance passes. So please consider excluding my business at least, grandfather my business in from this ordinance. Thank you.
Next, we have Tomas Torres.
Thank you. Good morning, City Council. Is it? Oh yeah, that's working. Good morning. Thank you for having us today. Dr. Tomas Trevises. I'm the Executive Director of the Southern California chapter of the American Academy of Pediatrics. We represent 7 counties in Southern California, including Los Angeles County. and I'm here to actually support the ordinance. I understand and respect the comments that have been made so far. They're actually things that come up at every meeting, and they are valid concerns. But my position is to actually support and speak on the best interest of children's health. Tobacco has always been an unethical product. If consumed as intended, it will cause detrimental effects on a person's health. And our concern primarily is on the youth impact. Since 2018, the Surgeon General announced an epidemic of vaping. And vaping in teens is very detrimental because young kids all young individuals who have a developing brain that will not stop developing until age 25, when you introduce nicotine into their system, it causes effects of lifetime addiction that they cannot get away from. And the problem with nicotine addiction is that because it is associated with tobacco, tobacco has effects in the lung, in the cardiovascular system, and they are the primary causes of cardiovascular morbidity in the United States. We are in support of the ordinance. We actually released a publication over the weekend in support of your ordinance, and I would like to turn this in for the record, and which can also be found on our website. So we are actually based in Pasadena. So if you have any questions for us or you need any assistance from us, please feel free to reach out, and I'll leave my business card as well. Thank you so much.
We have Cristina Cardenas.
Good morning, Commission. My name is Cristina Cardenas. I'm a senior project manager with LAC USC Medical Center Foundation that has launched the Breathe Free South Pasadena Coalition as part of the Tobacco Control Prevention Program managed by the Los Angeles Department of Public Health, focused on educating and informing communities across California on the consequences of youth vaping, tobacco, and creating healthy environments to reduce youth access to those products. We are here tonight, or this morning, with regards to item number 3 regarding the sale of tobacco retail in South Pasadena. And we're also available to answer any questions regarding any community-based efforts and concerns that have taken place. I wanted to share a little bit about this issue. We've learned so much about this epidemic that is impacting communities across the United States and across the world. Vaping, tobacco use, and direct contact with secondhand smoke from those very products are hitting communities regardless of race, income, gender, and whether people are actually smoking or not. This morning, we are very pleased to continue this conversation that we've had with our coalition for about the last 2 years. And we have been very thankful to have been able to collaborate with the South Pasadena Senior Center, the Teen Center, Parks and Recreation, the YMCA, South Pasadena High School, and the district to allow us to meet with residents and teens to talk about this issue in public spaces, including concerts in the park, farmers markets, and various vaping presentations by students and for parents and for students, including the South Pasadena PTSA. We have some of our youth and residents that are part of the coalition who have submitted some public comments with regards to their experience with tobacco and their interest in item number 3. And we'd like to thank those coalition members for their time, their endless efforts, and their passion for improving healthy breathing environments in South Pasadena. This effort has allowed us to learn so much about how nicotine creates addiction, how flavors hook kids, the deceptive marketing practices by the tobacco industry, and how the brain is developed severely by the use of tobacco and secondhand smoke at such a young age. We were able to conduct community public surveys and found that 90% of South Pasadena's residents support restrictions on the sale of tobacco products. We also found that 67% of residents believe it's easy for youth to access tobacco products in the community. 2 in 3 residents support a law that prohibits the sale of flavored tobacco products. We also conducted youth purchase surveys with all tobacco retailers in the community, and we found that 18% of retailers were willing to sell flavored tobacco products to underage minors. So that totals 1 in 5 stores were willing to sell tobacco products without requesting ID. So we are here today. We're here as a resource. We've been working extensively with partners from Endgame and through the County Department of Public Health. And we're here as a resource to the city to provide support to retailers with any sort of education and information that they need, and also any support. There's cities across the state that have done this, and we're really looking to Manhattan Beach and Beverly Hills, who have been able to work with their retailers to support them during the time of transition. So thank you so much for having us.
And we have Odom Stamps.
Good morning, members of the commission. I'm here representing myself, Odom Stamps at 318 Fairview, longtime citizen, former mayor. I'm also a business owner, and most recently a shop owner at 1518 Mission Street. And I'm here to speak in defense of Fayez Karoum, Fayez's smoke shop, the cultural position of Fayez's smoke shop in the community with older, responsible cigar smoking people. And I'm here to talk about the positive elements of his shop. And the positive elements of his shop it is a place to gather and talk about ideas, socialize and have fellowship. It has been there for a quarter century or nearly so. It is a place where responsible adults can come and purchase a very premium product. The average cigar there is over $20 a piece. The alcohol that he sells, is from places like Duncan Taylor, again, a longtime member of our community shop. They sell premium scotches, bourbons, and other dark spirits. And it is a mecca for people who want the best of those kinds of things. It also has never sold any vape products. It has never sold cheap flavored cigars, and it does not sell cigarettes. That's not the point of this place, but it is a family business. It is a local business. It's been in our community for a quarter of a century, and there's no reason to run this family out of town because we're worried about children that are already prohibited from smoking. There's already an ordinance. You cannot smoke below the age of 21. You cannot smoke in public. These are already on our books. We don't need to run a good tax-paying business out of our town at a time when our town goes wanting to get enough revenue to do all of the things that are necessary. So I urge you to create a carve-out. I'm not asking you to strike the whole issue down, but I'm asking you to carve out an exception for this family, for this business, and for our community. And those of us that choose responsibly to pick up a cigar and smoke it every now and then and socialize and talk about life. Thank you.
We will now be moving on to Zoom public comment. If anyone would like to make a public comment via Zoom, please raise your hand. The first one is Julie Ruedas. You have 3 minutes. You can begin speaking now.
Thank you very much. Good morning, members of the Public Safety Commission. My name is Julia Ruedas, and I'm a policy analyst for Los Angeles County USC Medical Center Foundation, serving as a community engagement coordinator on the subcontract of the Los Angeles County Department of Public Health Tobacco Control and Prevention Program. We are excited to join virtually this morning, especially given that October is Healthy Lung Month, an opportunity to inform and educate on the importance of protecting our lungs against many diseases, including vaping. Coalition members have been focused on educating and informing the community of South Pasadena on the health impacts from the use of flavored tobacco. Part of their strategy has been to create education opportunities and programs to improve awareness about the dangers of addiction and to decrease youth vaping. We are here this morning to be a resource in regards to item number 3 of today's agenda, potential new ordinance for the South Pasadena Municipal Code regarding prohibiting the sale of all tobacco products. We are here to provide answers to any questions with regarding to community-based efforts and concerns about vaping that has been deemed an epidemic by the U.S. Surgeon General. California youth tobacco usage is increasing, where 1 in 10 Los Angeles County high school students say they are current e-cigarette users. Our efforts have allowed us to connect with public health experts across the state, some of which are here today to learn from best practices and model ordinances to address flavored tobacco. Given to school, our Breathe Free South Pasadena youth members were not able to attend, and some which are members from the Youth Commission, but have provided written statements to share their concerns and perspectives about vaping in their community. We are here to educate and inform the city of South Pasadena. We're very much interested in creating long and short-term solutions to reduce youth access to flavored tobacco, reduce the exposure to secondhand smoke, and also increase access to mental health and smoking cessation resources. We appreciate your time. We are thankful to staff and grateful for the opportunity to coordinate resources from the Department of Public Health and Public Health Law Center with staff in preparation for the potential new ordinance. Thank you for your time and consideration. We look forward to your continued partnership. Thank you.
Next, we have Corinne Van Grogian. Go ahead and speak.
Hi, I'm Corinne Van Groningen. I'm a board certified pediatrician in LA County. I'm also a UCLA preventive medicine and public health fellow physician. And similar to Dr. Torices, who spoke earlier, I'm a member of the American Academy of Pediatrics, Chapter 2, which represents pediatricians in South Pasadena. Similar to some of my colleagues who just spoke, I am in support of the new ordinance to prohibit the sale of all tobacco products and applaud other LA County cities such as Manhattan Beach and Beverly Hills who've already taken this step to protect the health of children. So as a pediatrician, I know that tobacco use is one of the most important health threats to children, adolescents, and adults. Tobacco use harms not only individual tobacco users, but also those who are exposed through secondhand and third-hand tobacco smoke exposure. More than half of US children are regularly exposed to tobacco smoke, and the vast majority of tobacco and nicotine dependence starts before 18 years old. And so effective tobacco control policies can decrease tobacco's toll on children's health. We've seen across the country that we have instituted smoke-free legislation and bans on flavored tobacco. And these are two important steps towards protecting children and adolescents from the harmful effects of tobacco smoke exposure and consumption, but we need to do more. And this ordinance is a perfect next step to protect the health of children. And so again, as a pediatrician, I support this ordinance and thank you for your time.
We have no more hands raised via Zoom. Next, we will read in a public comment that asks to be read into the record. I am Myron Dean Kwan, a resident. My family has lived here for 6 years. Our 2 boys attend Monterey Hills Elementary School. We strongly support the passage of the ordinance listed in item number 3. In 2021, and with the ongoing pandemic, it is especially clear that the South Pasadena has no legitimate reason to allow the sales of tobacco products, including vaping devices. The chemical from smoke and vaping harm everyone, whether directly inhaled or as secondhand smoke, and our young residents remain at high risk of addiction due to any access. I am very active with other parents in Monterey Hills as well as the local Y. Literally every single person that I speak to about this issue is in support of this ordinance. In addition, I have been an active member of the local coalition of South Pasadena residents and businesses in support of this ordinance. Although not everyone can attend today's sessions, I can freely share that all our members are in support of this ordinance. Please support this ordinance unanimously and ensure that the city council also can ultimately pass this ordinance. Your action through this commission will truly save lives. Thank you so much. Sincerely, Myron. There are no more further public comment.
Great. If the commission's ready, staff would like to present
Or
the.
Chief, my apologies. We have one more hand that just raised. Would you like to accept this last comment?
Yes, please.
Hi, this is Monty Messick from the LA County Department of Public Health. I have Dr. Quo here. I believe he was going to present after the staff presentation, but I just wanted to touch base if he should present now.
I believe after the staff report would be sufficient.
Okay, thank you, Chief.
Okay, Chief, we are ready to move on then.
Great, thank you. Thank you, Commission, for being here today and allowing us to present this. In an effort to promote a healthier environment and lifestyle for its residents, the City Council has directed staff to research a policy of banning the sales of all tobacco products within South Pasadena. Several cities across the nation have implemented similar bans banning flavored tobacco products. However, South Pasadena will be, if passed, will be one of only 3 cities, Manhattan Beach and Beverly Hills, that would ban all tobacco products. And the goal of the ordinance is aimed at reducing opportunities for youth and minority residents from beginning tobacco use who are targeted by big tobacco companies as primary future consumers. And to speak more on this issue, we have Police Department Administrative Analyst Allison Worley here to present the staff report.
Good morning, Commissioners. My name is Allison Worley. I am the Management Analyst with the South Pasadena Police Department. So as the Chief had mentioned, both Beverly Hills and Manhattan Beach have proceeded in initiating a ban of the sale of all tobacco products within the city. Both of those cities have opined that such a ban is legal, and each one took a slightly different approach to the path that they have gone. Beverly Hills, for example, has created carve-outs for their existing cigar shops and carve-outs for existing and future hotels due to their tourism industry. Manhattan Beach moved ahead with a complete ban on the sale of all tobacco products, including convenience stores, and I believe they had one tobacco shop in their city, not a cigar lounge, but a tobacco shop. Our city attorney in South Pasadena is still doing a deeper dive into the legal implications of implementing a tobacco sales prohibition. Of course, as I mentioned, BH and Manhattan Beach have opined that such a ban is legal, but it is important to note that the city should be willing to appropriately address any potential legal challenges, including litigation expenses with the tobacco industry or local businesses. Something that is important to keep in mind is that the potential ban on the sale of tobacco products could be consistent with active living and mental health well-being in the Healthy Community section of the city's 2020 general plan. And this action is also supported by promoting improved air quality as referenced in our climate action plan, which was attached to the staff report here. Basically, it's important to keep in mind that the goal of this ordinance is not to close businesses. As the chief had mentioned, it is an opportunity to reduce availability for the youth in the city and also provide growth opportunities for our local businesses. The city has looked into several different options for business mitigation, and staff has spoken with both the downtown Los Angeles branch of the Small Business Administration and the Small Business Development Center at PCC. There are a number of options which we are looking to connect our local businesses with, including loan assistance, sales and marketing, consulting, legal and accounting advice, web and social media strategy, and also importing and exporting. There are also a number of loan options for businesses, including loans with delayed repayment dates, economic injury loans, loans for example, women-owned businesses, things like that. And again, we are looking to put together some sort of forum. Due to COVID, we're not sure if we want to do something in person or possibly via Zoom, but something to really connect these businesses with these opportunities for mentorship and consulting free of cost, which obviously would be extremely helpful for them. Let's see. I don't really have anything in addition to what was kind of included in the staff report, but if there are any clarifying questions that the commission may have, Chief, unless there's anything you'd like to add. I know we have Dr. Cole on the line also, who would like to give a few talking points. So if we're ready for Dr. Cole, he's welcome to go ahead and speak.
If we could have the doctor present, that would be great.
Dr. Cole, if you're still on the line, would you like to go ahead and present?
I think Dr. Kuo was included as an attendee, so I don't know if Dr. Kuo, if you'd raise your hand, maybe they can unmute you. Yeah, Dr. Kuo has his hand raised.
Perfect. Please proceed, Dr. Kuo.
Dr. Kuo, we can't hear you.
It looks like he still needs to be promoted to panelist.
Yeah.
All right. Can everybody hear me now?
Yes, we can hear you.
Yes, we can hear you.
Oh, great. So Honorable Chair and Commissioner, my name is, as mentioned, Dr. Tony Kuo. I direct the Division of Chronic Disease and Injury Prevention for the LA County Department of Public Health. Very happy to be here on behalf of the department's leadership. I thought I wanted to provide some facts and information basically on the health and economic burden and tolls of tobacco use. Cigarette smoking, as many know, is responsible for more than 480,000 deaths per year in the United States, and this includes more than 41,000 deaths resulting from secondhand smoke exposure. This basically amounts to about 1 in 5 deaths every year, or 1,300 deaths every day. In California, 40,000 adults die annually from smoking, and 440,600 Californian youth, now age 17 and younger, are actually projected to probably eventually die from smoking because they picked up this health habit. Nearly all tobacco use actually begins during youth and actually progresses during young adulthood. So this is like a critical time period for adolescent development. More than 32,000 children age 18 or younger actually smoke their first cigarette every day. Nearly 9 out of 10 smokers started before the age of 18, and almost all started smoking by age 26. If smoking continues at the current rates, 5.6 million, or 1 out of every 13 of today's children or kids, will ultimately be affected by smoking-related illnesses. And as many of the speakers that came before me in the public comments, until age 25, nicotine really could negatively change adolescents' brain development, especially for things like cell activities that actually control attention span, learning, and memory. Nicotine is unfortunately also highly addictive. with the rise of vaping, for example, this was even before pre-COVID, this danger actually become even more pronounced. The amount of nicotine, for example, in some of the new e-cigarettes devices actually varies greatly, and in many cases are of higher concentration, and yet they are not usually labeled clearly. Youth may not be aware, for instance, that one pod of a popular e-cigarette device may actually contain as much nicotine as the entire pack of regular cigarettes. A recent study released by the U.S. Food and Drug Administration, the FDA, and the Centers for Disease Control and Prevention, CDC, estimated that more than 2 million U.S. middle and high school students reported currently using e-cigarettes in 2021. In LA County, at least 1 in 10 high school students are current e-cigarette users. And so as such, both FDA and the U.S. Surgeon General, as you have heard, has already declared youth use of e-cigarettes as an epidemic. The interesting thing is that, as you guys may have heard, earlier this week, the FDA announced it approved the Vuse e-cigarette for sale in the market, but not as a cessation device. This action is actually the first approval of a vaping device, bringing it into the same oversight as traditional combustible tobacco products, such as regular cigarettes. The FDA actually stated, quote, "While today's action permits the tobacco products to be sold in the United States, it does not mean these products are safe or FDA approved. All tobacco products are harmful and addictive, and those who do not use tobacco products should not start," unquote. In any case, LA County do have resources, as California, people who smoke or vape could get free help to quit, calling the quit line that are available. In terms of the economic cost of tobacco, and I just want to make a few comments about this. Nationally, the total cost of smoking is actually more than $300 billion a year, and this includes nearly $170 billion in direct medical care for adults and more than $156 billion in lost productivity. In 2009, the cost of smoking in California actually totaled $18.1 billion. And again, more than half of that is actually in healthcare costs, and $6.8 billion in lost productivity and actual premature mortality. In LA County, tobacco use is directly linked to the top 5 causes of death, and they are coronary heart disease, stroke, lung cancer, pneumonia, and emphysema. The pervasiveness of tobacco outlets obviously undermines a public health message that tobacco products are addictive and deadly, and it often normalizes smoking, suggesting that tobacco use is common and acceptable in spite of its risk. Tobacco outlet density increases the likelihood of smoking among both minors and adults, and living near a tobacco outlet is associated with unsuccessful quit attempts. Emerging evidence suggests that tobacco retailer reduction is associated with a decline in cigarette pack purchases. And as your staff report had mentioned, the 2009 Family Smoking Prevention and Tobacco Control Act specifically permits states and localities to prohibit sales of tobacco products. In California, over 100 jurisdictions has prohibited the sale of flavored tobacco products, and this includes 17 jurisdictions in LA County and cities like El Monte, Glendale, Manhattan Beach, and Beverly Hills. The last 2 obviously has taken additional measure of prohibiting the sale of all tobacco products. In summary, our health department is committed to protecting the health and well-being of youth and the public. And as part of its mission, we are very interested in preventing tobacco-related disease and death. And we certainly support local strategies that actually helps communities to be healthier and actually prevent youth access to all tobacco products. And again, LA County is here to help and have resources, including resources for tobacco cessation if needed. Thank you for your time.
Great, thank you, Doctor. Commission, I wanted to reiterate that it is staff's recommendation that an exemption be created for the one existing cigar shop. And that was primarily because 90% of its income comes from the sales of cigars and related products. Having done some outreach at that location, it is primarily a more seasoned adult social club, if you will. It does not cater specifically to kids or to underage individuals. So when looking at it, our goal was not to, well, rather to mitigate the fiscal impacts to our business community. So having said that, as Allison mentioned, there are a number of opportunities for our businesses to either look at loans, look at different marketing strategies, and all those were free of charge. The strategies and the marketing plans and whatnot offered by the SBA and Pasadena City College. In addition, should we adopt an ordinance of this nature, it is also staff's recommendation that we create a 6-month grace period, if you will, that would allow the existing businesses to either sell their existing inventory or to take advantage of one of those programs that we had mentioned earlier. That will conclude our presentation, and we're happy to answer any questions that anyone may have. Commissioner Ding?
Yeah, I have some questions. So I was reading the current, I believe it was like reading the current ordinance and the proposed ordinance. So is it that our current ordinance does not allow the enforcement of tobacco sales using youth decoys?
That is not correct. We
Okay.
can use it.
You cannot use it.
We can.
Oh, you
Yes, we
can use it. Okay.
Yes.
So yeah, the area that was highlighted was kind of confusing to me. So in the proposed new ordinance, we can continue to use youth decoys to enforce tobacco sales.
That is correct.
So let's see, I actually have a lot of questions. So I saw that you guys are recommending the cigar exemption. I guess my comment on that would be, it does seem, while it's on there, it does seem rather restrictive as far as they can't close for 60 days, they can't change ownership, they can't expand, things like that. It seems like it kind of, it's intended to grandfather them out of business at some point, is what it appears to me as. So that's just a comment. And another thing I did notice and was mentioned during the staff report was that the city attorney is still providing analysis on how it will hold up to legal challenges. I don't know because I haven't looked at it, but I would just assume that Beverly Hills and Manhattan Beach are probably in a better fiscal situation than we are. But I don't know. So I guess that's one area that does concern me. And I was actually talking to people prior to this meeting about it, and some of them included lawyers, and they were kind of just like, I don't know how that would survive a legal challenge. And even if it did, how much money is that going to cost the city in mounting that legal challenge? And I did also see in the proposed ordinance, there is a hardship exemption. In reading it, it sounds like, some of the people that presented today, convenience store owners, gas station owners, can apply for a hardship exemption. It's a rather comprehensive application they have to put forward. But one thing that I found interesting was that the city would determine the appropriate length of exemption. It's not codified if it's 6 months, 12 months. So in theory, it could be forever, which kind of seems like a loophole to me. Or, it's up to the city to decide. So you can grant someone a 20-year exemption from this ordinance and just let them to continue selling tobacco products. So things I noticed in reading the packet. And I guess the last thing that I'll say is a lot of the presenters did very accurately present about how tobacco is bad. But I think, like I said, from conversations with my neighbors, we're really concerned about flavored tobacco and vaping with regard to youth. That's the biggest threat to our youth right now. It's not dip, it's a little bit of cigarettes, and it's not cigars, as we've said. So I feel like all tobacco products is a little bit broad, and the potential cost of litigation and the potential, loss of tax revenue and fiscal impact, I think it's concerning to me, but that's all I have to say.
Absolutely. Is there anybody else? Commissioner Cow?
I did have a quick question. I think that per your report, Chief Solinsky, and the staff report, it's only Fair Oak Cigars, which would be a business currently in the city that sells tobacco products for on-site consumption, correct?
That is correct.
And have there been any reported issues at Fair Oak Cigars specifically with minors?
No, there is not.
And is this just a time for questions, or can we also discuss, or should I wait until everybody else has had their chance to ask their questions?
This is a question time, and then afterwards we'll give the commission time to discuss. And if you have any further questions, I'd be happy to answer them at that point as well.
Okay, and I don't have any further questions at this point.
Any other questions from Commissioner Alsaroff?
Yeah, I have a couple questions. And forgive me if I missed this in the packet, but do we have a sense of what the tax revenue annually on tobacco products that the city realizes is currently?
We do not. We were unable to get that information for this report. We're hoping to gather it prior to it going to the city council. Part of that has to do with our previous licensing process. As that's being revamped, we were unable to get accurate information.
And then how, I don't know if there, if you track this, or if there's a way to let us know kind of what the current status is of enforcement of the current smoking prohibitions, like the air, people are not permitted to smoke within a certain amount of indoors and restaurants in certain areas. Is that, I guess I have two questions. One is that being enforced? Is there, or do you sort of track that? Is there data about, how often that becomes an issue? Because I think part of this is obviously exposure. And I'd be interested to know what we know about that in the city.
That's actively enforced. It is something that comes up fairly frequently. It's not something that the police department goes out and proactively enforces. This is more of a reactionary. So when residents or businesses will call to report someone, police will go out there and enforce that ordinance. In terms of frequency, without having specific numbers on that, I would estimate probably 5 to 6 times per month.
Okay. And then in terms of enforcement of the current restrictions on sales, right? Because there's obviously restrictions that currently exist. Is that something that is also, does that frequently come up, or is
that comes up less frequent? It does come up occasionally, but nothing significant to where we would specifically target individual businesses for sales.
Okay. I think that covers my questions for now.
There any other? Yes, ma'am. Angelette.
Thank you. And I know we heard from the LA County Public Health. Do we have any localized data about rates of youth smoking, specifically in the city of South Pasadena, or rates of starting to smoke? Any local public health information that's more nuanced?
I will defer that to either Julia Ruedas or one of the LA County Health Coalition members. I believe they did a study and have been doing a study within the city. Do they have that information? I don't know if they're still on or not, but I do know they did a number of public surveys. They've been doing it probably for the last 5 or 6 months at various public events, and initially their studies were aimed at flavored tobacco. So I don't know that they did anything as far as the rate of new smoking or youth smoking. I do know that the flavored tobacco was a big issue. And then I want to say 90% of the residents that they surveyed voted in favor of eliminating flavored tobacco. As we came across and started to really look at this total tobacco ban, they didn't have as much time to do the surveys, but there was quite a bit of interest in it from the residents. Very similar results, is my understanding, in terms of eliminating tobacco sales.
Yes, Chief, this is Julia Ruedas from LAC USC. Thank you for that. And that is correct. That is correct. We've been out in the community, and that's exactly, we've had the opportunity to engage with community members. And as what you stated is completely correct. And my colleague, Ms. Cristina Cardenas, in person, she did state right now for you on the South Pasadena Youth Access surveys that we, the results that we have, where 18% of South Pasadena tobacco retailers were willing to sell, which is 1 in 5 stores. Thank you.
Great, thank you. So while that doesn't provide the actual numbers of new smokers, it does give you some sort of context as to the availability, I think, of tobacco products to our youth.
Sure. So we'll presume that the incidence and prevalence of smoking is consistent with the county, absent additional information. It's probably fair.
Okay, if there are no more questions, I'll conclude that portion and allow the commission to discuss further.
Go ahead, Stephanie. Did you want to go ahead?
Yeah, I just wanted to say thank you to staff for bringing this important issue forward. And thank you to our community members who have taken the time to submit their comments on this really important issue. I understand that tobacco sales is a really polarizing issue. On the one hand, I understand and agree that businesses, especially certain small businesses, could see a considerable impact in profitability. But on the other hand, I also see and agree that smoking continues to be the leading preventable cause of death, and that we need to do all we can to protect our youth. With that in mind, based on what I've heard today and all the things that we've seen in the staff reports and comments, I would actually be interested in seeing what a proposed interim ordinance might look like addressing the issue. Specifically, instead of the way that the proposed ordinance is currently drafted, which has an effective or enforcement date that wouldn't start for 6 months, my preference would be to see what proposed language would look like for an interim ordinance that prohibits the sale of tobacco for a time certain, perhaps that same 6-month period, but with a carve out for existing small businesses who can show that a majority or greater percentage of the viability of their businesses depend on the sale of the tobacco products. And then upon review of the interim ordinance, after say that 6-month period for potential consideration of a permanent ordinance, I would then like to see more concrete data from these businesses showing exactly how much they would be impacted. And additionally, even data reporting back whether these businesses have taken any efforts to retool their businesses to refocus on profitability regarding non-tobacco products. So I think that there's just, I get it. There's a really important aspect of, limiting this, limiting the youth to access to these products, but I also don't want to just, do a 180 to businesses who depend on these sales. And this is, at least at this point, the best balance that I can strike. But I would love to hear from my fellow commissioners as well as to what their thought processes are.
I agree, Commissioner Chow. I think that having some type of, well, I agree with point of having some type of percentage for the business. If they're, whatever that percentage may be, if their income is more than 75% based on tobacco. We don't want to close down businesses, but we don't, well, I should say, I don't want to see new businesses coming in with smoking at the forefront. And I do think that having this ordinance would be helpful, but I think the timing, as you suggested, is also a good one. If we could do a review, and maybe it'll take a year, I'm not sure, but I think I agree with that recommendation.
I'll sort of chime in here as well. I like that idea a lot. I am a little bit concerned about the legal aspect of this, because I don't want us to walk into a quagmire that will potentially do more harm than good in the long term, because I think the likelihood is, if we do end up in litigation, that this will probably be suspended, enforcement will be suspended during the course of that litigation. So this ultimately doesn't get resolved until much further down the line and cost a lot of money. And that's not to say that it may not be worth doing that, but if the current state is that the city attorney is still looking into this and still looking into the legal viability of such an ordinance, I think it might be premature for us to move this forward until that's completed. That's sort of my perspective. I also want to say, thank you to the community for coming out, because this is a very important issue. This is a very critical issue to everyone, to the business community, to the youth community, to families, and everyone in the city. And I think, I'd also be interested in potentially more data on, what the true impact is. And if we can get that during in the course of an interim order or ordinance, that would be useful. But my sense right now is that we may not be quite ready to move forward with something like this, especially given the kind of broad strokes that it would cover. Is there any other comments, Jeremy?
Yeah, I'll make a comment. So Commissioner Cal, you're recommending like an interim ordinance, kind of like with a sunset provision, but including grandfathering of existing businesses, or are you suggesting a 6 months ban and then revisit? 6 months ban applicable to existing businesses, and then we revisit for clarification.
So I think kind of a hybrid of what you said. I
Okay.
think what my proposal was to move forward with presenting council, or I guess they would be presenting us with revisions to the current ordinance, making it an interim ordinance, but instead of the implementation date, which is currently in there that says this, it shall not be enforceable for 6 months, for the interim ordinance to last 6 months or a year, whatever that period is.
Okay.
But with a carve out for existing small businesses who can show proof of, whatever percentage we decide we want to set, whether it's 75%. And then during that 6 or 1 year, whatever period that is, everybody has their homework, whether staff is going to be studying the impacts of this, whether these businesses are going to be collecting data to show staff, here's how much it's actually going to impact our businesses. But now that also the chair has also mentioned the legal viability of it, I also think that's an important thing to take into consideration, because at the end of the day, even with the passage of an interim ordinance, if it's not something that's legally viable and somebody does end up taking a challenge against a city on it, then the ordinance would likely be suspended for that period of time, all the while the city is incurring legal fees. So perhaps we are putting the cart before the horse here. And if the city attorney's office hasn't opined as to, whether or not we would be able to withstand legal challenge, then that's something that we need to consider as well.
Okay, that sounds good. Yeah, so now that I have clarity on that, yeah, so I guess just my discussion points would be, I do agree that current businesses should be grandfathered. I mean, I saw you mentioned 74%. I feel like that's really high. I feel like during COVID, any of our households or our businesses, you know, if we lost, you know, even 10, 15, 20% of our income, that's detrimental. So I think that in the hardship level does not need to be so high, in my opinion. If they can show some type of hardship, not any type of hardship, but I don't know what the number is. I don't know if it's 10, I don't know if it's 75, but I would say it's probably closer to like that 10%, 15, 20% of hardship. But it kind of sounds like what we're discussing, not necessarily proposing, is a ban on the issuance of new tobacco retailer permits or licenses. Granted that we're going to have we're proposing some form of carve out for grandfathered businesses. So that I think is a good idea. We could basically put a moratorium on new tobacco retailers in the city while allowing for some sort of exemption for existing businesses that can prove some form of hardship. And also from a litigation standpoint, you know, some cities like to be on the forefront of things. You know, full disclosure, my wife is on the Finance Commission. I don't know that we need to be one of those cities that is going to be spending hundreds of thousands of dollars in legal fees to prove that we're on the forefront of things. So I would feel much more comfortable if we limited this to flavored tobacco rather than all tobacco. Beverly Hills and Manhattan Beach can figure out how an all tobacco ban goes. I think we jump on the bandwagon with flavored with the hundreds of other cities that have already done it and probably survived legal challenges doing so. And we can revisit this in 6 months to a year once Manhattan Beach and Beverly Hills have spent their hundreds of thousands of dollars on legal challenges rather than our hundreds of thousands of dollars. Because the fiscal reality of it is we just can't afford it. So that's my 2 cents. And while I was talking to my neighbors and community members about this, one thing that did come up that came up when Stephanie DeWolf was city attorney was they would actually like to see cannabis dispensaries, something that says we cannot have cannabis dispensaries, because from a youth perspective, they're worried about flavored tobacco, vape, and cannabis. So I know Stephanie was trying to open a dispensary in town, but I don't know where it stands right now as far as the ordinance on that. So that's my comments. Thanks.
Lindsay, go ahead.
I wanted to, of course, thank the guest speakers, particularly the American Academy of Pediatrics, which took the time to come out and share the important public health and medical information. Smoking cessation is a core part of the Los Angeles Department of Public Health, which we all do support through our tax dollars. Granted, this is an accounting discussion, but we certainly could talk about the taxpayer impacts of tobacco use, nicotine, and residual lung health on both families, communities of color, and how it impacts health equity in a long conversation. While I think it's helpful to pontificate about the theoretical legal challenges and try to monetize those until we have actual information, it's a little difficult to weigh those particular risks. Certainly in my career, I've been fortunate enough to be part of the City and County of San Francisco Public Health, and we banned tobacco from Walgreens and from Rite Aid, one of the first places to do that. And certainly, as someone who works at a children's hospital on a daily basis, I can tell you about pediatric asthma and who we have in our emergency room. So while I am in support of us focusing on flavored tobaccos or areas that are known to be gateways, I don't think fear of litigation, unless we have actual concrete data from our sister counties about what they're facing, should be our predominant concern without referring it to the appropriate committee to weigh that particular issue.
So should we wait to hear back from the city attorney, or I guess what do you?
What I'm asking, Commissioner, is that the commission, given what I've heard, and there is a number of different thoughts on that the staff will take that into consideration. We will note it for council and allow them ultimately to make the decision with your recommendations listed. So what I'd ask is that the commission discuss and then take a vote on moving forward and either recommending the staff report go to go to council with the recommendations that you have listed, or if the commission is in agreement not to recommend the ordinance. Because there's a number of different, there are some conflicting statements by commissioners here and what your goals and ideas are. So it is my suggestion that we list those in the report going to council and ultimately allow them to make the decision. By the time we go to council, we will have an opinion from the city attorney. We've talked to other city attorneys. Obviously, they do not represent South Pasadena. They have different views. But by the time we go to council, ultimately, our city attorney will have given an opinion as far as the legal challenges and standings. But all this will be added into that staff report for council to be considered. So that is my recommendation. Thoughts?
Does
Anybody?
Councilmember Permits have any thoughts on the matter as one of many lawyers in this meeting?
No, I've appreciated the presentations and the discussion. I thought the agenda packet was fantastic. I also enjoyed the case law that's been attached to the agenda packet. So, but I have no questions.
So from a procedural standpoint, if we move forward with, the vote that we would be taking right now is to move the current draft of the ordinance with our various comments, or it sounds to me like, there obviously is some disagreement among the commission, which I think is good. Would all of those be incorporated in what we move up? Do we need to vote on sort of what the commission as a whole is recommending as a position, or some other version of what we're talking about? Stephanie?
Commissioner Cow?
Can I just ask a quick question to Chief Zielinski? If the next step is for staff to present something to council, is it actually going to be a presentation of an ordinance for adoption, or is it going to be more so presenting the ideas of the commission so that the council has time to relay their thoughts to staff so that staff can go back and revise an ordinance for an adoption at like a second meeting, or I guess not an adoption, but first reading at a second meeting for council?
Sure. Initially, our thought, we would take it for a first reading, and at that time we would get council's consideration, thought, any edits that they would want to implement. This is a pretty in-depth and complex issue, so I would anticipate there would be quite a bit of discussion among council, and no shortage of attorneys on council. I'm sure there's going to be a lot of competing ideas. So my goal would be to take this for a first reading, and then I would anticipate coming back with an edited version, just given the complexity of it, and then revisiting it. So I would be very surprised if we came in with a first reading and actually got it through without being directed to conduct further research or answer more in-depth questions.
I guess my question is,
procedurally, it would be a first reading.
But doesn't the modifications normally come at the commission level, and then the commission would come up with a version of the ordinance that we liked, or could at least we could we could pass through a majority vote for then council to review? Or are you suggesting we make a motion to bring the issue up with the attached bullet points kind of to go to council versus getting a draft ordinance that can pass the Public Safety Commission, then for council to take up and start their own modification process. If that makes sense.
A little confusing, but I think I got you. So what I'm recommending is that we take this staff report and submit it with your recommendations in it. Under when a report goes to the council, there's a section under it which is commission review, and that's where I would list and indicate everything that you have talked about today. And given the complexity of the issue, the number of differing opinions and thoughts, we would lay those out in a way that the council could see them, take those into consideration, and then take up their own discussion with those specific issues. And by then, some of these issues, as I mentioned, will probably already be addressed in the staff report. As I mentioned, the legal review by our city attorney would be completed. Commissioner Ding, one of the issues here was a grandfathering in of existing small businesses. While I wouldn't put that in the ordinance, I would certainly put it under your recommendations so that council could see that and potentially discuss it. Now, when the motion was made to look at this, that was not something that appeared those that made the motion were interested in seeking, but certainly bringing it up under your recommendations would cause them, when they read it, it would allow them an opportunity to discuss it and to weigh out the options and the potential fiscal impact. So something like that would not necessarily be drafted into an ordinance as of yet. That would be something after further discussion and direction from council.
I just want to avoid, or personally, just speaking for me, however the commission votes is another thing. I just want to avoid it being presented as, oh, the Public Safety Commission took a look at this draft ordinance and they approved it to be reviewed by council. I think it needs to be framed more like they looked at the staff report. This was their feedback for someone, staff or council, to implement, to use these comments to update the ordinance. And one last thing that I thought of that has actually come up a lot is, I know that Brian, you've talked a lot about the population of South Pasadena and how it's a lot of our traffic on Fremont and Fair Oaks is pass-through traffic. And we've talked about that before. So I guess the point I'm getting at here is we have gas stations on, Orange County, Orange Grove, Fremont, and Fair Oaks as our main thoroughfares. So how much of that tobacco sales, and there's probably no good way of figuring this out, but we can kind of guesstimate how much of those tobacco sales are actually staying in town, as far as the amount of pass-through traffic we have on those kind of main arteries.
Absolutely. And that's something certainly we can try to look at. I don't know if there's really a way to verify that, but we can certainly.
I guess unofficially another way you could do it is foot traffic into these locations versus vehicle traffic. I mean, if you have kids walking to the convenience store, that's probably more indicative of it being a local.
One of the challenges with small businesses, and I don't want to speak for all of them, but just something that we encountered when we were doing our community and public outreach, was the bookkeeping practices of some of these businesses to accurately reflect what their tobacco sales were, let alone foot traffic and or external traffic from outside the city. So that also became a challenge, and that was something we had a discussion with one of the business owners, and they just weren't able to accurately indicate how much of their business comes from tobacco sales. It was a guess at best, and but nonetheless, we can certainly try to quantify some of those statistics and look at presenting some numbers. As far as moving forward to the council, before the commission would take a vote, I would ask that we read this back and make sure that it's reflective of what your thoughts and opinions are. And as I mentioned, this would go in our staff report to council, and it would not indicate that the commission was supporting the ordinance as is, but that these are the concerns that you would like addressed. And there's a number of them that we discussed. So before you would take a vote on that, I'd like to read that back to make sure they're accurately reflected, and that I know there was a number of different things discussed, such as cannabis. If that was something you wanted in those recommendations, we would certainly do that. But if it was perhaps just a discussion amongst and something that you threw out there, then we would clarify it at that time.
Well, what about, for instance, I'm actually in full support of the ordinance as written, as it is, and ready to move forward with it. So I think that also has to be a piece of it too, is those that there are people, I mean, I don't know other people in the room, but I think that there may be, I'll just put that out there, that I am in support of the ordinance, given that it does look at the cigar shop, it takes that out of her position. So I just wanted to put that forward. And I would hate to delay for legal reasons, because I think that this is going to be a legal hot button. I mean, I want them to review and to move forward, but this is going to be a legal hot button. We all know it. It will be for every city that tries to do this. I don't think the tobacco industry is just going to be like, oh, that's fine. Okay, that's not what's going to happen. I don't believe, in my opinion.
I will add this in there, that talking to Beverly Hills and Manhattan Beach, as of yet, to what we know, there has been no legal challenges that they've come across. And I believe they implemented it in 2019, I believe is when they implemented it. And then there was that grace period, that 6-month ban or time period where they allowed businesses to sell off some of their stock. So as of yet, and by no means am I indicating that South Pasadena will be similar, but I just wanted to provide some sort of context that as of this time, there's been no legal challenges brought up. But certainly it's something that the city would need to consider, especially I think as more and more cities look at South Pasadena or look at some of these other cities with these creative ordinances on public health. I'm sure the tobacco industry will start taking a noticeable look. And I believe Monty has his hand up to add to that discussion.
I do. So enforcement for Beverly Hills and Manhattan Beach started January 1st of this year. And as to date, there has been no legal challenge to that ordinance, to either of those ordinances. And also to your point about trying to figure out tobacco sales at the retail level is very difficult. The one reason being is that tobacco taxes, the way that tobacco is taxed at the retail level is that it's just a general tax. And so there's nothing specific to it. So you can't really track it by product type at the retail level.
Great.
Beverly Hills and Manhattan Beach both looked into it and I think came to similar conclusions.
Great, thank you. So if there are any other questions, I'd be happy to answer them, or if there's further discussion, now would be the time.
I would just add to Commissioner Watson's point of view, if we want to take it to a vote, we'll get a certain outcome. It may not be, unanimous, which is okay. Good people disagree on a variety of things. But I would be prepared to, to vote on the ordinance as written today. Or also, of course, if that doesn't pass, then to share consolidated feedback to our council.
So if I may, just going back over my notes, should we move forward with this and the commission decide to give a recommendation to council, it would be that an interim ordinance be drafted for a period of 6 months, banning all tobacco sales, and then coming back and looking at what the impacts to the businesses are, and then looking at a potential permanent ban There's concern about the legal impact, potential enforcement, suspension should there be litigation. Looking at the fiscal impact to businesses during that 6-month period, what their losses would be. Grandfather in existing businesses and prevent new businesses. Focusing on flavored tobacco products instead of all tobacco products. Adding cannabis dispensaries to the ordinance. And then looking at statistics, potentially pass-through traffic and whatnot, and what measure of or what level of tobacco sales are specifically within the city. And then examining the hardship clause and coming up with something more measurable as to a percentage of what the businesses are suffering in fiscal impacts. And then also that, well, I think the best way to say it is certainly a complex and challenging issue, and that we had, the commission had various opinions in both in support and the concerns I mentioned. So does that reflect what the commission's discussion was?
I guess one thing, we keep talking about the lack of data. I almost feel like if we're going to do like an interim, we might give the businesses that want an exemption or a carve out the opportunity to get such data. So there'll be an interim ordinance banning tobacco sales for 6 to 12 months that goes into effect in 3 to 6 months. And you have 3 to 6 months to collect your data on tobacco sales, which you will need to apply for an exemption. If you say you can't do it or don't want to do it, well, then you're not going to get the exemption. But you need to be able to track, this hardship. You need to be able to prove the hardship, and they need to be given an opportunity to prove the hardship and be educated on what that needs to look like in order to obtain an exemption.
Yeah, and I was just going to say the same thing that Jeremy just said, that if there are businesses, small businesses that are going to say that they will be impacted because it's the viability of their business, and give them the opportunity to present such data. If they can't, then that's, their prerogative to do or not do it. But then another thing that I wanted to say, and this is kind of wearing my city attorney's hat on, but not as South Pasadena city attorney, but I think, having a more concrete draft ordinance that you'll prepare to council will enable your city attorney's office to provide a more detailed legal analysis, because it's not just the issue of whether or not a city can ban the sale of tobacco, but it's going to be what the devil's lie in the detail, right? Like, it depends on what the draft ordinance is actually going to say, and that's what your city attorney's office is going to have to analyze to see if there are going to be any kind of, for example, constitutional challenges to it at a later time. So I don't want to make it, an overly burdensome task for the city attorney's office to guess as to what the city council may eventually decide to put in the ordinance, but have, the discussion points brought before the city council so that you kind of have a leaning towards what the council is going towards, maybe a study session. So then the city attorney's office can really then look at the language that will likely be in the ordinance and analyze that language and those regulations for an analysis.
Yeah, and I just want to add, I think that, we're kind of being not necessarily urged, but encouraged to adopt or pass something to go look at council. But I think that, we're looking at, this going into effect 6 months from now, a lot of different things. We're still pending city attorney analysis on the ordinance as written. I think it might be a good idea to just send this back to staff with our comments for additional work. And then whenever that comes back with something that reflects something that the commission is more comfortable with, at that point, we can then approve it for council review. That's my thoughts. I'd rather not rush it and try to approve the ordinance as written, because I think there's, like I said, you know, I feel, you know, I have a family member who died from lung cancer, so we're a very anti-tobacco family, for lack of a better term. So I'm not trying to represent tobacco in any way, but the way the ordinance is written, as I mentioned from reading it, the city determines the appropriate length of any type of hardship exemption. So, you know, I know our city council members have a lot of integrity, but down the road, what if I make campaign contributions, do I get a 25-year exemption? Or how does this work? There's such a gaping loophole in the way it's written right now. It really needs to be codified a lot tighter, like 1-year exemption to be applied for every year or something like that. Not just the city can determine the appropriate length. So even, you know, with the goal of what we're trying to do here, I would not approve the ordinance as written because it's just way too loose.
Commissioner, if I may interject something, we seem to have lost the chief. I think he's having internet connections, but I just wanted to add something that both Beverly Hills and Manhattan Beach did offer hardship exemptions to their businesses. In Beverly Hills' case, to the businesses that were not included in the carve-outs. Some important notes that I think some of you may find interesting. Beverly Hills hardship exemptions were able to be applied for by any of the businesses affected who were not in the carve out. And they were determined in terms of length by an independent hearing officer. So there are a number of options, and there's a whole spectrum of options that a hardship exemption can take. Manhattan Beach took a different approach. They had a structured length of time. I can't remember offhand if it was 6 months or a year, but businesses were allowed to apply for that hardship exemption, but there was a kind of like a sundown clause or an end date to it, whereas Beverly Hills was on kind of a case-by-case basis. So there are some options here in terms of that. It sounds like several of you are kind of interested in the subject of hardship exemptions and how to go about doing that. So those are just a couple of things to keep in mind.
Yeah, and I think those sound much more reasonable than as appropriate, determined, you know, by the city.
Sure, of course, that is definitely open-ended language, but I just wanted to bring up that there is kind of a spectrum along the line of options to go if we were to include that in an ordinance.
I guess just to take kind of, you know, the temperature of the commission. What are people's thoughts versus flavored versus all tobacco and cannabis, which we don't even need to talk about, but because I'm just bringing it up because it wasn't even in my mind when I read this, but it was one of my neighbors that said, you know, people are just going to go to Alhambra or Pasadena to buy their cigarettes. I'm worried about vaping and I'm worried about cannabis. So that's just feedback I got.
And cannabis requires additional levels of study and, you know, different public health data.
Let's just punt
we're
that.
Gonna, I mean, I can talk. I will take off my personal hat and just say I would think we should have additional information as a group to discuss that. I mean, I think the spirit of the original ordinance, right, is to take the public health information, particularly that was shared by our county public hospital, and think about ways we as a municipality can be more of a healthier, well community. Obviously, there's 88 cities in LA County, so they do things in a different order of operations. The challenge, of course, of saying someone will go across the lines, they certainly do for fireworks. So that's an area that gets noisy for us all here. But there are areas where municipalities can set out something consistent with the city's values and priorities for public health or public safety. And it does result over time in a cultural change in the state. So I would be in favor of including all tobacco, not just flavored, and eventually cannabis, but the cannabis is a bit of a hot button and probably requires more data for this commission to evaluate.
Thanks.
Yeah, and I tend to agree with Commissioner Angelots too. I think that dispensary or banning dispensaries is definitely something that our city can look at, but I don't think, based on how I've seen ordinances that have been drafted, that kind of prohibition would meld well with the ordinance that we have in front of us right now. There are just too many different components. But I also understand that flavored tobacco products are kind of the hot button issue for use right now, but I would prefer it to just be a ban on tobacco, not just a ban on flavored tobacco.
This is Monty Messick from LA County Department of Public Health. I just wanted to jump in really quickly. Regarding cannabis, so state law only allows cannabis to be sold legally in cannabis dispensaries. And in cannabis dispensaries, you can't sell anything that's not cannabis related. So in other words, you can't sell tobacco products in a cannabis dispensary. So, and likewise, cannabis can't be sold in a retail environment where you can sell tobacco products. So actually, cannabis and tobacco are regulated very differently. And so, for example, your tobacco retail permit that licenses your tobacco retailers won't license cannabis dispensaries. So it's an item that's probably best separated. It seems like they should go together, but I think in terms of regulation, they don't.
Thank you.
You know, I was just thinking about like the cost to the businesses too. I mean, we do know some of those costs. I mean, not for small businesses, but for example, like CVS stopped selling cigarettes, right? Rite Aid now only sells them for age 21 and above. Like, I just wonder what statistics have already, I mean, they don't directly relate to South Pasadena though, but I'm wondering what statistics are out there about the when people have stopped selling cigarettes, what's the loss of income has been. But I don't know if it could directly relate to our small businesses in South Pasadena. But it just brings to mind that there is probably some data for other businesses.
Oh, Monty Messick again, sorry. The California Department of Public Health is doing an evaluation of Beverly Hills retail tobacco ban, and I think they are looking at that in terms of how it's impacted the retailers. And a group in Washington to seek action on smoking and health is doing a case study on both Beverly Hills and Manhattan Beach. And so I can try to get that information to Allison Worley.
That would be very interesting. Thank you.
I'll jump in here. To answer your question, Jeremy, I'm on a similar wavelength to Lindsay and Stephanie. I think, you know, it's flavored tobacco and vaping now. Who knows what it will be next? I think, you know, we know that there are traits specifically related to tobacco that are the problem. And I think if we start trying to kind of like guess and attack certain things one at a time, we'll end up kind of back here every other year. I do what I will say is, you know, I think it seems like we may all agree generally on the concept here. It seems that way. I don't want to speak for everybody, but it generally seems that we all kind of agree on what the goal is. It's just a matter of how we get there. And I think timing obviously is always on these kinds of issues, public health issues, of the essence. So I'm wondering, and I know Brian's had some issues with connectivity. It looks like he's on, but I'm can't see him. It seems like there's kind of the maybe a faster route and maybe a not so fast route that we have in front of us right now, which is, you know, we can sort of have a vote on the current language, period. And that will either pass or not, or vote on moving the staff report up to council with our comments about what might be useful in terms of additional information, in terms of an additional layer of approach, an interim order, that sort of thing, so that council gets it sooner and we start moving that discussion forward sooner. It sounds like there is another potential route, which is for us to send this back to staff, get further input from the city attorney, and move this, you know, back to staff and then back to the commission for us to vote on something more concrete to then move up to city council. It seems like those are the three kind of potential routes. Obviously, I don't want to speak for anybody else and if there's another recommendation, but I'll sort of open it to anybody who wants to maybe make a motion that we can consider specifically, unless there's further comments or further input that you guys want to make.
So just trying to be as inclusive of everyone's thoughts, it sounds like the consensus is for us to take this up as an all tobacco ban, not carving out, nothing to do with cannabis, nothing to do with flavors, just all tobacco. That we would like to see some type of exemption process that is a little bit more tightly codified than what is currently being presented, as far as lanes and who's determining whether it's a viable exemption or hardship. Hear more about what the city attorney has to say on the matter. Generally ban any new tobacco retailers in town. And as Commissioner Cowell recommended, perhaps looking into an interim ordinance with sufficient time for small businesses to come up with the data required to prove their hardship, and then revisit it after whatever the interim policy is. And so far we've been talking about small business exemptions. So I guess what that would mean is, I know that there's a couple grocery stores. I don't think that grocery stores would probably qualify for small business exemptions. So that generally would mean like if Pavilions and Vons or Ralph's sell, they would no longer be able to. So that I'm fine with too, because we're really concerned about the fiscal impact of small businesses, and to a much lesser extent tax revenue from grocery stores, which are already very high tax revenue producing. Did I miss anything? Does that sound right, generally speaking? I mean, yeah, I'll defer to you, but I think that what we're talking about and what's written in the ordinance, there's a lot of daylight. And I personally would like to see it reworked a little bit more by staff before us sending it up to council.
Okay. I think the most efficient way to do this is to have that be a motion and let's vote on it. Unless somebody else.
Brian, are you there, or is whoever's taking our minutes able to note down this motion?
Staff has been taking notes on what you indicated for a potential motion. I believe the chief is on the line. I think he was able to connect back via his cell phone. I don't know if he has anything he'd like to
Okay,
add.
no worries. Okay, so I will make a motion that the Public Safety Commission request staff to revise the report and draft ordinance to include the following items, or reinforce the following items: that the ban should be on all tobacco products, that the exemption or hardship process be more structured than what it currently is, that we have additional analysis or input from the city attorney, that we propose that there will be that this ordinance not allow for any new tobacco retailers in the city, and that there be a mechanism to grandfather in small businesses, either through just the grandfather process or the hardship exemption process. And lastly, that the structure of the ordinance be looked at with a future implementation date that allows the retailers to procure the data they need for applying for a hardship exemption, and that it be in force with the sunset provision to be revisited by council at the end of that sunset period. Sorry, that was really long.
Commissioner Ding, just a quick question. Is your recommendation for staff to bring all that back to our commission for review, for recommendation to council, or for staff to implement those items and bring it straight to council for adoption.
My recommendation is that it come back to us. I know that we have a council member liaison, but I think the mechanism that I've seen these things get approved and sent to council is, hey, they approved the report and this draft ordinance. Here's some feedback, but I think I don't want anything to get lost when it goes to full council as far as it being confused that we approved the draft ordinance as written.
Is there a way to nuance that, meaning that we are supportive of the ordinance as written, comma, with the proviso that the city council must, evaluate? I mean, one thing is the sales tax revenue. I mean, to me, that seems like solvable with time, if only because it sounds like for some of the data that we're seeking, it may not be finite and we might have to use other corollary cities to drive that. And I'm just concerned that we could end up being a bottleneck of data collection, and when that may not be our core role and function, unlike a city council.
Well, I think procedurally, we're supposed to take up the motion or offer a substitute motion. If somebody wants to offer a substitute motion, I'm fine with that also. But I don't think anything in my motion is actually calling for more data. I think it's just asking for revisions to the ordinance. I guess the only part where I was calling for more data is city attorney analysis, but that's pretty broad. I don't think we're asking for specific analysis. I could take that out. I don't know. I think the city attorney can opine after the edits are made. So do you want me to remove that and restate my motion or offer a substitute motion?
Commissioner Ding,
Yes.
can you hear me?
Yeah, I can hear you.
Okay. The only thing, you're fine on your motion there. The only thing I would ask is that the grandfathering in of existing businesses is that would go under the opinion and recommendations of the commission. My understanding is that would be something that council would look at rather than including that in the ordinance. And if council wanted to go back and make that that policy change, we could certainly discuss that, but to include that in the ordinance without getting further direction from council, that is the only clarification I would ask that you take into consideration.
Well, I guess, isn't it all subject to council? I guess that's just kind of what the commission is saying, and then it's up to council whether or not to adopt it or not. With regard to any of these, they could literally say, that's great, we don't care, let's just adopt it as is. I think council has the authority to do whatever they want with our recommendations.
Certainly they do, but I don't want to get off track in what the motion from council was, and that was to create an ordinance banning the sales of all tobacco products.
Well,
I think we're
you can, if there's no second, somebody can offer a substitute motion. Actually, if there's no second, it's not a motion. So if someone wants to offer up a different motion, I'd be happy to hear that.
I just ask one clarifying question before we do that. Is this a topic that will likely, if it passes today, get on the city council's agenda in the next month?
Chair, no. This is a topic that'll take probably some months of rewriting and research and clarification. So I would not expect this to get on council's agenda. And also the mayor sets the agenda, and December there will be a role change on city council. So I would not expect this to get on the council's agenda till after the first of the year.
So the reason I ask that is because maybe we aren't further delaying anything by having this come back to us for further consideration, especially given that I think we have a good, I think all of us are kind of invested in what this is and focused on this. And I think it would be great to have this come back for further discussion if we can afford to do that time-wise. And I do think that, that's part of what our role is here, which is to sort of be a resource for community input in our in the decisions that our city is making. So I would throw that out there as potentially something to consider in how we approach this going forward.
And sure, you can certainly make that motion. And if that's what is approved, then we'll be happy to do that.
You know what, I think maybe at this point, I would second Jeremy's motion, because I think that accomplishes, in my view, it accomplishes that goal of getting further feedback, coming back to the commission and then considering it. So Jeremy, assuming that that still is out and hasn't been withdrawn, I'll second it.
Yeah, if you second, then we would do a roll call.
Yeah, so let's go ahead and do a roll call vote. Commissioner Angelos?
Just so we're clear,
Can I have someone read the motion again?
Yeah, I will reread it. So I will make a motion that staff revisit the report and the ordinance with the following feedback from the commission. Let me just unmute so I don't have to hold my space bar. Okay, with the following feedback from the commission, that the ban should be for all tobacco products, that there should be a more structured hardship exemption process, that there should be no new tobacco license, retail licenses approved, and that there be a grandfathering or carve out for small businesses only, and that it should be drafted in such a way that it would be interim in nature and provide retailers enough time to gather the data with regard to the degree of hardship that they would face from this ban in order to procure an exemption. And then the details can be filled in by council as far as how long interim, how long the forward date is, and things like that.
Before we go on for a seconding, since staff is here, is that pretty clear direction from staff should this motion pass of what's being looked at or looked for from you?
Yes, I believe. Oh, sorry, go ahead, Chief.
Commissioner Cow, so a hardship exemption as defined, a little more in depth, and what percentage, if I'm hearing you correctly, we're going back to what percentage of a fiscal impact that would make on those businesses, a carve out for existing small businesses, an interim ordinance for a period of 6 months to a year to assess the impact to the community, both from a fiscal and health perspective. Is that correct?
I believe so.
I did not hear a carve out for all existing businesses. I'm sorry.
Commissioner Ding.
Only small businesses is what we kind of agreed upon. So that would not be like Ralph's, Vaughn's, Pavilions.
I might propose extracting that before the vote. I'm not sure but in fairness, that might be a point of discussion, just defining what's a small business and what isn't. The current ordinance, or there's discussion about the cigar shop, is my understanding as written, if I have that correct.
Okay.
But that's the only grandfathered institution that's referenced, given that 90% of their revenue is that. So this would be a more of expansive perspective.
Yeah.
Okay. Well, procedurally, you could offer a substitute motion, or we could just all vote no and start from scratch, because it's already been seconded. So I can't really change it at this point.
Lindsay, do you want to offer a substitute motion with that?
The substitute motion I would offer would be to advance the ordinance as written with advisement that there's further clarity from the city attorney about the exemption process. But that's a very much narrower, a much narrower.
And sorry, Commissioner Ding, can you just reread just that one portion that you said about the small businesses, just so I can frame it in my mind before we vote?
So that there be, so the small business exemption the way I've motioned it is basically it would end up, they would end up utilizing the exemption and hardship process. So we could just take it out and then leave them to the exemption and hardship process for any business of any size. And that would just be that. So, you know, Ralph's could apply for it and that would be that. Because we probably do get into things of considering what's small business, what's not a small business, you know. So yeah, we're kind of playing fast and loose here, but would you like me to modify my existing motion and say it again? Does that sound good?
For clarity, I think so, but I think we have, we have technically a substitute motion, and so if we have a substitute motion withdrawn, then you can reset.
Okay.
That might be cleaner,
Fine
or
to
if you want to go.
draw a substitute.
Okay. So she's withdrawing it. Let me amend my motion. Okay. So I will motion that staff rework the staff report and the interim ordinance to include the following feedback from the commission: that the ban should be interim in nature, with a future effective date that would allow retailers to determine the degree of hardship to their business, and have a sunset date where it could be revisited after the termination of the sunset date. That the ban apply to all tobacco products in the city. That the exemption and hardship process be more structured with regard to how long it is, how it's approved, who's approving it, and those things, and that the ban should not allow for any new tobacco retailers in the city. That's my motion.
Okay, and I will second that motion. Okay, and why don't we just go into a roll call vote? Commissioner Angelats?
Aye.
Commissioner Cow?
Yes.
Commissioner Ding?
Yes.
Commissioner Kung?
Yes.
Commissioner Watson?
Yes.
And I will vote yes. So Commissioner Donnelly had to leave early, so he is absent, but otherwise this motion passes.
And just one final comment with regard to the determining of the hardship. I think that as an opinion piece for the staff report, just a recommendation, nothing that I'm proposing that we vote on. It should be direct tobacco sales. I get if I'm stopping to buy cigarettes, I'm probably going to buy a lottery ticket. I may buy Coke, I may buy a 6-pack of beer, but I think that this hardship should be calculated as direct tobacco transactions. Trying not to inflate the fiscal impact by saying they're not buying all these other things because of it. So direct, just as a opinion, I guess.
Okay. I think with that we are, I think, in a position to move forward with our agenda. And I'm sorry, just a moment. I'm going to pull up our. Okay, I think that finishes the action and discussion items on our agenda. So let's move.
No, it does not finish your agenda item. The procedural violation. There is no transparency. The procedure is not over. Or violation.
So I'm just going to step in really quickly here. I think when we did item number 3, we started it off with public comment, did we not?
We did.
Yeah.
Okay, and then we moved on, and once public comment was over, the commissioners heard from the staff. Actually, it was the staff that reported. We had public comment, and then I believe the commissioners were able to ask questions of staff and then also discuss the item. And then we had a motion, we had the second motion, and we took a vote on it. And I believe procedurally, we've done all that we've had to do for number 3. If a staff member that's present in council chambers can alert us to something that we may have missed, then we can reconsider that. But from my perspective, I think we've done everything.
And I would just remind folks that there is a process to provide public comment. We appreciate all of those who did. And in the future, if there is another public comment you wish to make, that you follow the procedures to do so. So thank you all.
You in court.
Let's go to City Council Liaison Communications. Councilmember Primitive.
No, in light of the hour, I'm going to postpone my report till next time.
Okay, thank you. Staff Liaison Communications.
I also will be extremely brief, but I do want to update you on just two very important items. Number one, the fire department does remain fully staffed as we're kind of still navigating through this pandemic time. Two important points that will be coming back to this commission is that obviously, in addition to the pandemic, it has been, again, one of the busiest wildfire seasons that we have faced, with 2 or 3 of the largest fires in state history. So staff from the fire department has been meeting with representatives from Edison and discussing the public safety power shutoffs that have been affecting the regions, mainly up north, and in the area of LA County that have hit the criteria for those shutoffs. South Pasadena has not had any PSPS shutoffs as of yet, but again, staff is working closely with Edison and redefining to the extent possible the circuits that are within our high fire risk areas and those circuits that would potentially be disconnected in the event of South Pasadena hitting the criteria. And really, one of the main reasons that we haven't is we typically do not get the low-lying winds. Obviously, we get the high heat and the low humidity, but just our topography and the way it's laid out, we haven't gotten the winds. But on that note, it remains a concern for us. And along those same lines, what's important for us is a quarter of our city, as you know, is a high fire risk area. And sometimes it is difficult for us to leverage funds or grant funds to assist in the mitigation of the hazardous vegetation that lies in the area of our city that is high risk. So staff from the fire department will be representing the city as part of the San Gabriel Valley Council of Governments, working together as a region to help leverage grant funds and looking at all the cities in the region and leveraging grant funds to assist in the mitigation of some of the hazardous vegetation that lies within those communities. And unless there's any questions of staff, I will limit it to those two updates.
There was the public comment on the issue to the fire chief regarding vaccinations and addressing kids at school not with the lack of masks. Do we need to address that today? Can those questions be held to next session? I'm not sure.
That was a general comment. So just to be respectful of the Brown Act, to be very broad in the response. Obviously, we've been at the forefront of this pandemic since the beginning, and we take the risk extremely serious as fire department staff. I will say this, that the email did point out and referenced an older health order, and the subsequent health orders in July 28 and September 28 did lessen the restrictions on masks being required outdoors. Although the first phone call I received was from the captain who was on duty that day, and obviously the optics and whether or not they should have been wearing masks. I've immediately had discussions, and obviously as a department, we want to work alongside the community and wear masks at all times if it's an event that is promoting that, and that email did hit home with us. But again, just to point out that there's a technical side and then there's the optics side of it. But never is it our intention to blatantly not follow health orders or show up to an event and not follow the orders as written. And unless the chair wants to agendize it, I think I should limit it to a brief comment about the public comment.
Thank you, Chief. I did have kind of a general question for you related to the vaccination question. Do you have a sense, or are you tracking the vaccination percentage of your department?
Can you repeat that again?
I was just curious about the percentage of vaccination of the fire department.
So the Human Resource Department is currently in a meet and confer with all city employees. There was a general all city employee questionnaire that went out. The fire department had a pretty good idea of early on in the pandemic, we were the first ones offered vaccinations. We had a pretty good idea of the percentage, which was over 80% of our department. We didn't have a final count because that really was left up to the employees. It was not mandated to provide. The questionnaire that went out from Human Resources was, but that information has been kept confidential pending the meet and confer process with the city, with all employees. So, you know, best guesstimate is we are well over 80% of our staff in the fire department has been vaccinated, but I can't give you an absolute number on that, being that it's basically run through the Human Resource Department, and the employees are given the opportunity to, you know, apply for exemptions, again, which would be kept confidentially.
Okay, thank you. Chief Selinsky.
One quick announcement, and that is Men's Central Jail, the County Board of Supervisors has voted to close, and there are some concerns that that'll have impacts to our community. But one of the more pressing issues is not that it's closure in and of itself, because I think all the Board of Supervisors have agreed that it desperately needs to be closed, but it's replacement. And I know Catherine Barger, our county supervisor who represents South Pasadena, is looking to replace it with a mental health care facility. And that would certainly be very beneficial to South Pasadena. So I would ask that the commission consider that and maybe look at a discussion at another time and whether or not to write a letter of support or to reach out to Supervisor Barger on those thoughts. And that's all I have.
Okay, let's move it to Commissioner Communications now. Commissioner Angelots.
No updates. Supportive of Chief Selinsky's comment for this commission to weigh in on the proposed conversion and increasing of mental health support to the county.
Okay, Commissioner Cow.
No further comments, but I agree with Commissioner Angelots that I would like to see, you know, a letter that we can consider in support of the conversion.
Great, Commissioner Ding.
No comments, just wanted to thank staff and all the community members who provided input for today's meeting.
Commissioner Kung.
Just really brief update. Since the reopening of our schools in person back in August, there have been less than 24 positive cases that have been reported in our school district. Which is actually a pretty good, very low rate, and it's not been transmitted in the school from all our layers of mitigation and protocols. Just also want to mention that this Thursday, October 21st, is the great Shakeout earthquake drill. So that'll be also happening at the schools, and also encourage everyone else to also participate and relook at all your earthquake safety measures too. That's it. And I also agree with everybody. Thank you everyone for your support. And I know everyone worked really hard, extensively, you know, to bring up all the issues before us. And so I appreciate everyone's efforts. Thank you.
Great, Commissioner Watson.
I have nothing to report at this time. Thank you.
Okay, I'll be very brief. Thank you all for the comments, for the discussion. This is a very spirited and substantive discussion, and I appreciate all the input, all the work that staff put into the report, and all the community members who came out. Really appreciate that input, and I'm glad to see that there is folks are focused on this issue. The only additional comment I have is October is Domestic Violence Awareness Month. I know City Council had a presentation from an organization called Peace Over Violence at their first October meeting. I think folks who are interested, please, I suggest you go back and take a look at that. That video is up online. And with that, thank you all very much, and we are adjourned. Have a great week, everyone.
Thank you very much, Chair.